Hi everyone, welcome back to another MedDent Network Wider Research Society presentation. Today's topic is Overdiagnosis and Medicalisation by Arya, Anvi, Abdullah and Isha. I hope you find this topic quite intriguing and informative. So with no further ado, let us get started with today's presentation.
Overdiagnosis is often confused with misdiagnosis, but they are actually very different. In overdiagnosis, the diagnosis is correct, the condition is present, but it would never have caused symptoms or harmed the patient during their lifetime. Advances in screening programs and imaging technologies have made it possible to detect diseases much earlier and identify very small abnormalities. While this has benefits, it also increases the likelihood of detecting conditions that may never become clinically significant. This can lead to overtreatment, where patients undergo surgery, medication, or regular monitoring, exposing them to side effects, psychological distress, and potential complications without improving their long-term health. Medicalisation refers to the process of classifying normal life experiences or biological variation as medical conditions. Although this can improve recognition of conditions and increase access to treatment, it may also contribute to overdiagnosis by broadening diagnostic criteria. So, why does it matter in healthcare? First is patient safety. Unnecessary investigations and treatments expose patients to adverse effects and medically induced harm. Second is psychological impact. The diagnosis of a disease may increase a patient's anxiety, stress, and alter self-perception. Third is resource allocation. Over-testing and over-treatment consume limited healthcare resources and increase healthcare expenditure. Fourth is clinical ethics. Clinicians may balance the benefits of early detection against the principles of beneficence, non-maleficence, and informed shared decision-making. Lastly is evidence-based practice. Healthcare systems should ensure that screening programs improve clinically meaningful outcomes rather than simply increasing disease detection.
Before looking at real examples, it is important to remember one of the fundamental principles of medical ethics, non-maleficence, or first, do no harm. Modern medicine has achieved remarkable progress. Earlier diagnosis allows diseases to be detected sooner, treatment to start early, and survival rates to improve. In many cases, screening programs have saved countless lives, and I've showed the advantages and disadvantages here. Early diagnosis, timely treatment, improved survival and prevention, whereas as everything in healthcare, there are risks, such as overdiagnosis, overtreatment, anxiety, side effects, and healthcare costs. And we are going to explore these cases. Yeah. So, South Korea's thyroid cancer screening. In early 2000s, thyroid ultrasound became widely available in South Korea. As a result, diagnosis of thyroid cancer increased by around 15 times. At first glance, this seemed a major success in terms of early detection, but researchers noticed something unexpected. The mortality rate from thyroid cancers remained almost unchanged, and that was due to the cancers which were being detected being papillary thyroid cancers, which would have never caused any symptoms during patients' lives. And consequences were unnecessary thyroid surgeries, lifeline thyroxine replacement required, and surgical complications such as vocal cord nerve injury, which caused permanent damages to patients' lives. And then comes the thalidomide disaster in in 1950s and early 1960s. Thalidomide was prescribed to pregnant women for morning sickness and was advertised as a safe medication. And consequently, thousands of babies were born with limb abnormalities, and major changes were required to drug regulations. Both these cases highlight different aspects to the same ethical principle. Whether diagnosing too much or introducing treatments too quickly um, without enough testing is harmful. Medical professionals must continually balance the desire to help patients with the responsibility to avoid extreme harm.
Impacts and ethical considerations of overdiagnosis and misdiagnosis. Impacts. Overdiagnosis happens when a condition is diagnosed that would never have caused symptoms or affected a person's health during their lifetime. Although early diagnosis can save lives, it can also lead to unnecessary tests or even surgery that can expose patients to risk without providing any real benefit. Being given a medical diagnosis can also affect a person's mental well-being by causing unnecessary stress or anxiety and making them see themselves as ill when they may never become unwell. In addition, overdiagnosis places extra pressure on the NHS by increasing healthcare costs and using valuable time, staff, and resources that could instead be directed towards patients who genuinely need treatment. Medicalisation can also contribute to this by turning normal experiences such as aging and all mild symptoms into medical conditions that may not require treatment. Ethical considerations. Overdiagnosis raises several important ethical issues. It challenges beneficence because while health professionals aim to improve patients' health, diagnosing conditions that would never cause harm may not actually benefit the patient. It also relates to non-maleficence, as unnecessary investigations and treatments can cause physical side effects, emotional distress, and financial costs that could have been avoided. Autonomy is equally important, as patients should receive balanced information about both the benefits and risks of screening and diagnosis, so that they can make informed decisions about their care. Finally, justice must be considered because NHS resources are limited and spending money and time on unnecessary investigations may reduce access to care for patients with more serious health conditions. Ultimately, there is no perfect solution and healthcare professionals must carefully balance the benefits of detecting disease early with the potential harms of overdiagnosis while respecting the full principles of medical ethics.
As Arya has said, overdiagnosis is when an issue is classified as a medical problem but will never give the patient any symptoms. In dentistry, this often results in overtreatment, where a patient undergoes a dental procedure that may have never been necessary. One example is the treatment of non-cavitated caries lesions. This occurs when the surface of the tooth is still intact, but tooth decay weakens the inside. This can damage the outside if left to develop to form dental cavities. Because of this, dentists often treat these lesions. However, most lesions actually won't develop further. Their progress can often simply be monitored or treated with a fissure sealant. Dentists often overlook these sealants in favor of different, more invasive treatments and procedures, which can use up valuable resources, time, and cost patients money. Another example of overdiagnosis in dentistry involves scaling and polishing. Scaling is scraping the teeth to prevent the buildup of substances like plaque, whereas polishing is a final step after scaling to tidy up the teeth. Scaling and polishing is a common procedure, often to prevent serious gum disease. Despite its common usage, in healthy patients, studies show little to no advantage of doing this procedure, even though almost 50% of adult dental treatments were scaling and polishing in 2025. In the same year, it was reported that over 12 million of this procedure was carried out. So, just as in the first example, this procedure is often a case of overtreatment. In dentistry, medicalisation occurs when slightly abnormal tooth traits or habits are treated as a dental problem requiring intervention, even when treatment may not be medically necessary. It can also be referred to as wish-fulfilling dentistry. Dentists and physicians may agree to comply with a patient's request or wish to build rapport and help a patient to feel less anxious. One of the most common ways that medicalisation manifests is in aesthetic treatments, also known as cosmetic dentistry. To understand this, it is helpful to look at trends in dentistry over time. In the past, oral hygiene was often neglected as many people were not aware of its consequences, especially on wider parts of the body. The 1900s revolutionized oral healthcare by increasing its integration. More people were educated about the dangers of dental health problems. The 1900s also saw that public water was fluoridated, which naturally improved the oral health of people in many countries. As well as this, advancements in technology meant that the prevalence of many problems and diseases decreased majorly. Recently, there have been more developments in the world of aesthetic enhancement procedures. There has also been a major shift from using dentistry for necessary medical conditions to using it for cosmetic reasons like teeth alignment and tooth whitening. The rise in patients undergoing cosmetic procedures is due to many things, such as social media trends or a patient's desire to improve their appearance and self-esteem. However, on the other hand, it can also be seen as medicalization. Many characteristics that are deemed aesthetic flaws aren't necessarily part of a dental problem, just the result of many environmental and genetic factors. This is especially important to consider as cosmetic dentistry procedures have risks of complications and pain. Patients may also be dissatisfied with the final appearance, which can incur large costs to fix. Wisdom teeth removal is the second example of medicalization. Some people believe that wisdom teeth must be removed at some point in everyone's life, but this is not necessarily always the case. Although wisdom teeth can cause problems, including misalignment or damage to neighboring teeth, this usually only occurs when there is not enough space in the jaw for the teeth to develop properly. Prophylactic removal is when dentists remove wisdom teeth even though they aren't causing any of these problems. This is mostly to prevent it causing future conditions. However, some papers, including a review from 2016, find that this is an unnecessary procedure to prevent future dental problems. In fact, keeping wisdom teeth can actually provide numerous advantages. Examples of these include helping to break down and chew food better and protecting the structure of your jawbone. The key here is to take a more personalized approach to dentistry. By monitoring each patient individually, dentists are more able to understand the progress of certain traits. This will allow dentists to review whether a patient needs a treatment or if that would just be another case of medicalization. Thank you all for listening.